So this second screencast is going on to talk about information exchange and also how we explain medical conditions. So there's going to be several points within a consultation where this skill might be really useful. And it could be at the beginning, because it could be a simple question, does the service user know what a dietitian is or what a dietitian does? Do they understand what the dietetic service provides? Do they understand their diagnosis? What the disease is and how it links with nutrition? Or about the physiology. Sometimes we need to explain how the medical condition links with food and why they're going to have to follow a particular diet. Not just that they do, but why? How does it link with how the disease is affecting their body? So there's lots of different things that we might want to be having that process of providing information and checking that the person understands what we're talking about. So we have a useful process that can help us with this. And this process is called EPPE. Elicit, permission, provide, elicit. So the first bit, eliciting, is about finding out what your service user knows already. Yeah, has this been explained to you before? Could I check what you understand about the role of a dietitian? Have you seen a dietitian before? Because if the answer to those things is, well, no, it hasn't been explained, or it was, but I can't remember anything about it, it just went over my head, I was in such shock. We're needing to check what that person knows. But it could be that, your person with type 2 diabetes actually is a practice nurse or, a consultant medic who actually does know a bit about type 2 diabetes. So you don't want to be explaining something, making assumptions. You explain based on what the person already knows and what the gaps are, if there are any. So find out what they know already, elicit what they know. Then ask permission. So, would it be useful for me to go over what type 2 diabetes is or how it affects your blood sugar? So you're asking permission and making sure that the service user is happy for you to explain. Because sometimes people don't want the explanations that we think they should have. So after eliciting, we ask permission. And providing we get that permission, so do check that you're actually, they're saying yes, that'd be great, or yes, please, or nodding, something that gives you permission. Don't just go straight into it. So what often happens is that people check what someone knows and then go straight into telling them without checking that that's what the service user actually wants. So we get permission and then we provide information. And we're going to provide it in everyday English. And that's often quite difficult because as we, learning about medical conditions, we learn about them technically, we learn about the physiology, we learn about the biochemistry, we learn about the terms. And actually for our service users, we need to be thinking about everyday language. Or if we're going to use a technical word, that we explain it. And also that we don't put it in the way that is suggesting that, well, if you don't follow your diet, this is going to happen. So you're not trying to threaten people. You're trying to explain in a very neutral and balanced way that this happens if this happens. And this is what's going on. Excuse me. So we explain. And often it's good to explain in small chunks, not give someone a complete lecture. So we need to keep our explanations quite succinct and clear. And that's why it needs a lot of work to get good at them. So once we've made our explanation, we need to check that the service user, what they've made of that. And what do you think of that information? Would you like me to explain any further? What we don't want to do is say, well, was that useful? because most likely people say, oh, yes, because they don't really want to tell you that, no, it made no sense whatsoever. Um, so often people are very kind to us. And if we say, was that use? Oh, yes, yes, thank you. They don't then go on to say, but what about this? Or I don't understand that. So, we need to be in that position where we're willing to check, what they made of it. Is there anything they'd like you to explain again or explain in more detail? So you're checking the understanding and going with what they want and what they know and what they understand. It's really good if you can to get them to explain it back to you. So then you really get a good understanding of what they have taken on board from what you have provided for them. So when we look at this idea of providing information, we are talking about plain English. So we need to think about what words that we use. So if you're explaining type 2 diabetes, you talk about blood glucose. Okay. What's that? Insulin. You might think for us they're very commonly used words, but for a lot of the general public, they're not. And even if you say something like a hormone called insulin, does that make any sense to people? So we need to be checking that the terms that we use, wherever possible, we're using them in everyday language. Even things, just to warn you, I get really wound up if I hear people saying, talking about carbs. What? Yes, we all know what carbs are, and a lot of people do, but not everyone does. So use words properly. Talk about carbohydrates, yes. And what are carbohydrates? They're starchy foods and sugary foods. So we need to keep them into everyday language. Calories. Yes, most people understand what calories are. But does your service user understand them? So be careful in what you use. So if you're going to use carbohydrates, talk about foods that like a starchy, like potatoes and rice and pasta, or sugary foods like biscuits and sweets and chocolates. You're putting it into a way that your service user is likely to understand. So you've got to be listening and trying to work out your service user's level of understanding. Don't make any assumptions. So, however intelligent someone might be, their knowledge might not be in the same area. One of my best friends is an engineer. She has a PhD, but she talking about engineering makes no sense to me. I have a PhD, but me talking about nutrition and communication makes no sense to her. So both intelligent people, but our knowledge bases are very different. And of course, most people won't have that kind of knowledge base that you are expecting. So do keep checking when your explanations have been given. What did you make of that? Can you explain that back to me? So that you can check that level of understanding. So we have to practice providing information in everyday language. So we're going to spend a bit of time in the session working on this, but try and spend a little bit of time now, maybe stop the screencast and start thinking, how do I explain these terms? How do I explain these medical conditions in everyday English in a way that isn't going to be loaded with emotional baggage, that it's just an explanation. It's not adding in those negative emotions to it. So we need to be thinking about how we explain those things. And just to give you some examples of where we might use plain English, rather than saying blood glucose levels, we might talk about sugar in the blood. Everyone understands sugar. Glucose, they don't all understand. Arteries, just blood vessels. Cardiac means the heart. Cholesterol is a fat in the blood. Saturated fat are usually fats that come from animal-based foods. So we might use saturated, but they're usually animal-based foods, like cheese and lard. Polyunsaturated fats, they're fats from plant-based foods, like seeds and olives. they're more monounsaturated, but you know what I mean. Something like when you're explaining celiac disease, you don't talk about villi. You might say that villi are something that we have in the gut, and they're like finger-shaped bulges that stick out of the gut wall. So you can use illustrations. You can draw them. You use illustrations like with celiac disease. You have these villi, but if you eat gluten and you have celiac disease, it will damage them, so they end up flat. So there's ways of explaining things that we need to work on. And that's part of what we're going to do and part of what I'm going to be encouraging you to do over the next couple of weeks.